So one of the great things about having your knee replacement at Riverside is that we really focus on you as the patient. We understand that this can be a really stressful time, a really overwhelming time. And so we have one point person that you will be spending a lot of your time being in communication with, and they help coordinate your care across all the different avenues and subspecialties. One of the other great things about Riverside is we have a team approach. And we have many different individuals involved in your care who are experts in many different avenues of healthcare, all of whom are on the most up-to-date information as to what will optimize your outcome. In terms of recovery, it's important to understand that everybody's going to recover at their own rate. So it's important that you try as best you can not to compare yourself to your friends, your family, or other neighbors. But in general, you're up and walking the day of your surgery, you're working with physical therapy for the first 4 to 6 weeks afterwards, and you're continuing to have improvements in your pain and strength and mobility after surgery for that time. We know that people in general recover for a full year after replacement. Usually by about 6 weeks after surgery, people are walking independently, and most people are returning to work between 6 and 12 weeks from surgery, depending on what line of work they do.